I'm impressed that everyone has the stamina and you're sticking this out. And we'll try to make this a bit more lively. Sort of harking back to like the first words of the day, there are some themes that just keep running through, correct? So one being what Lori just raised about relationships. I hope that we will show you by example that we have developed very strong relationships because of the work that we've been doing together. Another is that regardless of what the issue is, the psychological and emotional trauma for all people in Ukraine is fairly consistent. I was really heartened, I think probably others with me were too, to hear several of the surgeons refer to that need. So we're going to talk about mostly is a specific integrative model that's been used in the US for a while. Oleg had a vision to bring it to Ukraine even before the big war broke out, and now he and his colleague SOFIA have been successfully applying that model and have become an example for lots of hospitals in Ukraine. So I'm going to start by allowing each of you to do introductions. Let's start with Oleg.
Thank you very much, Jackie.
Introductions about who you are.
Only this? Okay.
For that,
okay.
Yeah.
I'm Dr. OLEH BEREZYUK. I'm a psychiatrist and psychotherapist and chief mental health department in the Lviv First Medical Union and Unbroken Rehabilitation Center.
And POLINA.
My name is Dr. POLINA TESLYAR. I am a consult liaison psychiatrist at Brigham and Women's Hospital here in Boston, and I run our division of women's mental health and reproductive psychiatry as well.
And SOFIA?
Hey, my name is SOFIA, and I'm a psychiatrist and psychotherapist as well. And it's my boss in there, so I'm a little bit stressed tonight. Hi,
You're
Ola.
right. You're right. Watch out.
Yeah, I'm trying to keep up.
All right, so our first question is for POLINA to just define what consult liaison psychiatry is and how it differs from traditional psychiatry.
So I actually went to look up a little bit of the history of consult liaison psychiatry when you asked me to do this, and it's also sometimes called psychosomatic medicine. And it turns out that the field began in the US in the early 1900s, actually in response to the changing climate because of World War I and World War II, and the recognition that you can't really have the surgeons and the psychiatrists in separate buildings because we are treating the same patients. So what consult liaison psychiatry is that we work in the medical setting. So we're psychiatrists who are very comfortable with very complicated medical and surgical patients. In the US, there's a special training pathway for that after psychiatry residency. And I would say the biggest difference between the work that I do and kind of a general psychiatrist is that a general psychiatrist has a very linear relationship with the patient, whereas we see ourselves as having kind of like a triangle relationship. We have a relationship with the patient and the medical team taking care of that patient, and we need to take care of both the patient and what they need and the medical team and what they need in order to be able to take care of that patient. So it's more, as Jackie's saying, it's collaborative. It can happen both inpatient and outpatient, but we have a different approach.
What's also interesting too, something POLINA just alluded to, which I think is also a theme that we should be thinking about throughout these 2 days, which is healing ourselves, right? I mean, the trauma that practitioners are experiencing from what is happening in Ukraine, we need healing, practitioners need healing themselves. So Oleg, you had this vision, even before the big war broke out. So I'm wondering if you could talk about what motivated you to bring the integrated model to Ukraine, what the resistance was like in those days, and what's shifted since February 2022.
Thank you, Jackie. I changed my speech today already a few times as a reaction that I am hearing here. And I would like to say thank you, first of all, to all of you today that we are here and we are exchanging the knowledge. And I was especially thank you for those people who are recognizing the role of mental health in today's situation. thank you to the face-to-face program. They worked in our hospital too, and the reconstruction face reconstruction patient, probably the most vulnerable patients regarding mental health, and probably the first in the list of patient with a suicidal ideation and suicidal not finished act. They need a really good support, and also thank you for those guys who are working with the epilepsy, because we're gonna have tons of the traumatic epilepsy, and they also recognized it, and the many surgeons here also talking about this. Why I know about all of this? Because I am a psychiatrist who is working in general hospital, and now in general hospital in the Ukrainian, in the mental health, in the first medical union, the psychiatrist is very often is a part of clinical conferences on very difficult patients. And starting from the general surgeon, they are ending with the neuro surgeons. So it's very important that the mental health finally return in Ukraine to the family of medicine. It's very metaphoric, but it's very realistic. But how it's happened? First of all, this is not new story. Yeah, in Europe they start to do this in 18th century, not in in Europe, in Great Britain, and after that in Philadelphia, but blooming period of developing of psychiatric wards in the general clinics was after the Second World War II. Why? Because there was a need of it. And why it's not happened in Ukraine? And we just opened the first mental health department in the general hospital in 2021, October 7. Why? It's two reasons for this. Actually, one. It's a stigma. And now we're repeating this word very often, and many of us don't understand it actually, what does it mean. In Ukrainian language, we have a very nice word for this, kleymo. And kleymo, it's different from stigma. It's a very, very bad word. And act to people, to claimite людей. And this stigma has two parts. The one existential, the phylogenetic, fear of madness. Yeah, we are afraid of madness. All of us, genetically, I think. Phylogenetically. And the second part, much worse, it's our colonial past. Our colony, the Soviet Union, they prohibited development of the humanistic science like psychology, psychotherapy, psychiatry. Why? Because it's no need for slaves to be a good psychologist and know how to use it. No need. And the second, they forced by the international community after in the 50s and the beginning of the 60s to close their concentration camp in Siberia. Yeah, because it's not good to have a concentration camp in the victorious country. And they, of course, they could not lose the control. And they use psychiatry. They use psychiatry to punish people. They made psychiatric hospital a prison. And this is not the metaphoric thing, this is the realistic thing. I used to be a doctor, psychiatrist, working in the old-fashioned psychiatric hospital. And I knew that nurses there told us about those days. When famous Ukrainian composer BEREZYUK was a patient of one of the department in the psychiatric hospital, and he was so nice to them because he gave them a signed plativka. Records. And they were very happy about this. So, but he was punished by his independent position and a great influence on the population. So, and this punishment psychiatry made the very bad thing, the biggest stigma that people are afraid of. And to change it, we cannot rebuild the old hospital, isolated usually not in the city, and they isolated not only from people, they isolated from medicine. And I had a dream. A dream happened to be started in the United States. I always prepared to be an OB/GYN doctor from my nursing college history. And I came to the United States to study biology, to be a good OB/GYN in 1991. And I lived in Ukrainian village in Chicago. I love Chicago, except the weather. And next to our village, it's the St. Mary Hospital. Probably somebody from Chicago is here. And I just accidentally was touring the hospital. I don't remember the purpose. And I see the psychiatry department in the middle of the hospital. And I asked to get in. It was absolutely medical facility, like all others. And I started to have such a dream, even though I was preparing to be OB/GYN. But finally, I received second major psychology, and finally I became a psychiatrist in 10 years. So it was not happening, but just because. And I started to dream to have such a thing in Ukraine. And it was the circumstances that we started to do it only in 2020. And it was a great resistance. The doctors, especially surgeons, they were saying, why do we need this crazy house in our hospital? Now, surgeon is the one who say, no, we need them. You know why? Because the patient who working with psychologists, psychiatrists, they can discharge faster. It means it's helping them. But it also was resistant from the officials. I would remember forever that one of the ministry official said to my friend, they gonna do it only stepping over my dead body. And we did it. But fortunately, this official is alive and now supporting our activity. And this was our goal, to have a victory because it's needed for the medicine, and for psychiatry, and of course for the patients.
So hopefully we'll get to some of how it improves outcomes. And I'll tell you that Sophia, one of the times that I was in Ukraine, did take me to one of the old-fashioned siloed psychiatric hospitals. And it was an experience for me, I will say. But Sophia, I have a two-part question for you. Can you talk a little bit about what you learned when you worked with Dr. TESLYAR in consult liaison here at the Brigham, and what core skills have you brought back to your practice in Ukraine?
Regarding to dreams come true, I also had a dream when I was a child, and it was going to Harvard. And it did happen, thanks to everyone out there. Miss you. So yeah, regarding the dream, regarding the work, it was one of the best experiences in my whole life, not lying. Why? Because it was so warm and welcoming in there for me, and for me to learn more, for me to learn something I've never thought about. It's POLINA, it's women mental health. I've never heard about it before. In Ukraine, there's no such thing, well, for now, but I think we are planning on doing something on that, because it's so important to integrate mental health into general medicine back again. Me saying as the daughter of a surgeon, so I can say that it was very, very important for me to realize that human body is not just the body and the mind and the arms and the legs. It's like integrated, and we cannot see it from different points of view. So CL psychiatry was very charming for me. And I thought that you have to be very, very intelligent to do this. And that's true. So you have to be very, very intelligent and very broad-visioned, I would say. You have to know neurology, you have to know neurosurgery, you have to integrate all of your knowledge into your work And you have to collaborate with different specialists, especially surgeons and orthopedics, because sometimes, well, maybe it's better now, as Alex said before, but a few years ago, it was very, very hard for us to tell surgeons that they need us for treating patients. My father is a surgeon, and he was very skeptical about me going into psychiatry 8 years ago. So it was one of the best experiences for me to see that it's working. And as Alex said, he had a dream. In 1991, I wasn't even born yet, but I kind of felt like, yeah, I know. I know. But I kind of felt that this dream is going to be true. So we did it. And thanks to all of you, it's working. And I can see the results. And I think that everybody else, including surgery and orthopedics and every other doctor, can see the results of us doing what we are doing. But the most important thing is, as for me, as I would say, is empathy and hearing and understanding other points of view. Like general medicine, I don't like the word general medicine, but still, we are part of general medicine and we are as helpful as everybody else.
So, Oleg, can you speak a little bit about how you and Sofia really are starting to disseminate the model to other hospitals and other healthcare centers?
First of all, we are the big union. First Medical Union in Ukraine includes 4 hospitals. And we decided to do this, first of all, by doing. We decided to promote it by doing. So we opened in 2021 the psychiatric ward in San Panteleimon Hospital. Next year we open in the psychiatric ward in the Children's Hospital, and the next year we open psychiatric ward in the St. Luke's Hospital when SOFIA is working. And the next, we start to open the outpatient facilities, the centers of mental health in every hospital. And also, we start to educate people. We start to invite people from other hospitals to show that you have to push your facility, your administrators to do this, because the stigma is still there. And when the psychiatrist coming from other cities, we say, don't come to us yourself. Come to us with your chief doctor, because you cannot open it by yourself. You have to have support from the administration. Ministry is already on our side, because the minister issue an order. They're probably, I'm paraphrasing, that all general hospital must have such a facilities. But now it's stigma not allow them, because they don't want to have a crazy house in their hospitals. And but we today I heard about a lot of education. We have to educate people. This is not about madness. This is about the disease. And this is a very profitable, according to Ukrainian, how it's called, NCZU payment, yeah. And but it's a problem. We have lack of psychiatrists. We have to educate and give a contemporary education to psychiatrists, because stigma is still there. Even a young doctors, residents, few years ago residents, they have a problem with the empathy and compassion to the patient of psychiatric patients. It's a very sad thing to acknowledge, because it's a stigma is going so deep, because the mad people, they are not the usual people. And this is a very important to understand. And sometimes we have a very difficult conversation with those people. But education, I hope, and the good results. And it's obvious. Now we have a problem, because to our psychiatric wards, we have a line. Patient waiting for a few weeks. Sometimes it's impossible with the acute psychosis. But for the other disorders, they are waiting for the few weeks to get to our hospitals, not to the old-fashioned hospital. Even though we made good for the old-fashioned hospital because they start to compete and they start to rebuild it, and they receive huge money from the government to rebuild it. It's good. But the walls, they're very important in psychiatry. Aesthetic circumstances, very important in psychiatry. But people and compassion and empathy is the instrument of healing. That's why we have to, the stigma is going to be there for a while, and we have to fight it.
It's true, actually. I mean, at some of the siloed hospitals, you'll see that they're trying to introduce integrated modalities and practices. So it's interesting. It's worth visiting and seeing the contrast. But along the lines of stigma and resistance, I'm wondering, Sofia, if you can speak a little bit. We're talking about trainees, doctors. What about patient resistance? What's your experience there with patient resistance?
Thank you for the question, but for me, honestly, the other doctors were more resistant towards us seeing patients than the patients were for most of the cases. And that was sad but true. But sometimes, as for me as a young woman, sometimes we have, well, I think Oleg would agree with that sometimes we have some issues with patients who do not trust young women in listening or caring or being empathetic towards people who had gone through torturing or some war trauma sometimes, and it's hard for us sometimes, but we have good results with being patient and giving those patients time.
Yeah.
So
I would like to, it's we will talk about this tomorrow more precisely, but it's true that some young, but it's not only regarding women, also a man, but soldiers, especially the young one, the 20, 21, 25, they, I think, by their nature cannot open themselves. Oops, I'm very sorry.
Oh.
This is reminding from reality.
Yeah.
But I don't know why it's happening. I try to turn it off.
So I will say this, because I just got the signal that we're done. The conversation doesn't end with any of these topics, which, we're just brushing on. So is that in Lviv?
I'm sorry. I don't
yeah,
know.
it's here.
Yeah. Be safe. Okay. So, sir, please, please. Yeah. So why don't we end, Paulina, with one word of advice for people?
Yeah.
Go ahead.
Yeah, so I think we have the same resistance in the US, actually. We have, in my department, we're probably one of the largest consult liaison departments in the whole country, and we don't actually have an inpatient psych unit in our hospital at all because Harvey Cushing didn't want there to be one 100 years ago, and so we still don't. But I think the way you break down these barriers, the way you eliminate this stigma is by not keeping it separate. It's actually and when a patient doesn't want to talk to me, I can talk to their surgeon and say, do this.
Exactly.
Approach it like this. So a lot of our value is, obviously we interact with patients directly, and that's a big deal too, but a lot of our value is helping the other clinician, because most of our consults are not like, which med should I use? They can look that up. Most of the consults are, why is this happening? Why is this person behaving like this? Why are they refusing? And where we can help is there. And it does take time to build trust and prove that we can help. I mentioned women's mental health just because it happens to be what I do, but we probably do more of that than any other place in the country too, because our OBs over the last 15 years have learned that we help them. And so they refer to us more than any other OB department anywhere. Because I used to work in a different hospital and they were like, oh, I didn't even know I could talk to a psychiatrist. So when we show up and we help, it takes a little while, but then people catch on and then they want more and more of it. I'm glad that they pay for you, because in the US, the biggest problem is we don't.
You will win.
Thank you.
Thank you.